This is the Dr. Don Show. It's your health, it's your life on the Astral Radio Network. Now, back to the show.
Listeners, we're talking about symptoms associated with brain injury. And don't forget, injury to the brain is not limited to just that great big mass of nerve tissue bouncing inside the ball we call the skull. That brain starts to extend, as you heard earlier with our expert, Dr. Michael Freeman, as a path of nerve that starts to extend through the opening in the skull. That opening is called the foramen magnum. And you need to not exclusively think. You need to not just reference brain injury as just the brain in the bony ball called the skull, but also that extension of nerve tissue that starts to pass through the skull into that upper brainstem area there. Because as the brain moves, that whole spinal cord is stretching. The whole brain is moving, but it's tethered. It's all integrated and tied to the nerve mass that continues down your spine, known as the spinal cord. So what we're looking at here, and we spoke with Colleen earlier, she doesn't remember being hit. Her head, she says, doesn't hit the side of the car post, didn't strike the glass. I imagine you had a seatbelt on, Colleen?
Yep.
So her head didn't hit something, but she felt and heard this large crack in the neck, and then had all the associated disorientation of acquired brain injury, traumatic concussion, all those other words that essentially describe that this was a nerve injury to the head and upper neck. It wasn't something in the small of the back or the left elbow. So, Colleen, what are some of the resources that you can tell listeners that they need to be aware of? And one of the people that you I think you were also at that brain injury conference. That was in Ottawa a couple of weeks ago?
Yes, I was.
And we spoke 2 weeks ago with one of the speakers that you were on the panel with, Christine Durham from Melbourne, Australia.
Yes.
And one of the things that I remember Christine saying, and we had a caller come on the program at the same time, and one of the therapy advices, because the whole emotional state of the brain injury was such a tremendous challenge, Christine, I believe, said, you know, even starting by recognizing the warmth and comfort feeling from a warm cup of coffee. In other words, a single positive event was something to anchor yourself and move forward. Is that something that you concur with in your book?
Oh, yes. I think that the moment that I could feel guilt is that I felt, mine was a little bit different than Christine's, but the moment that I could feel guilty, I realized that, oh, I was going to be okay, because I was totally numb of feelings, whether good or bad, funny or sad. They were pretty neutral. And a little bit difference between Christine, she was in a car accident with many broken bones and parts. She got a different type of attention than...
You didn't get any.
Exactly right.
Yeah, she had some for 6 months until the bones healed, and then she got none. But you didn't get any from day one.
No. And I'm not the only one like this. So it's, you know, this is just how it is. So the more that we can educate people and letting people know that their bodies don't lie to them. So listen to your bodies. You have to become your own doctor, and you cannot delegate your health. You can't just go to the doctor and say, fix me, because the brain is much, much too complicated for any one person to do that. So if you're thinking that you do have a brain injury, or you're feeling some discomfort, and you can feel the discomfort not instantly, you can feel it 2 weeks and 6 months down the road. Exactly right. And those are the ones that are really scary. So there's local organizations, there's BIAC, which is the Brain Injury Association of Canada, Overseas Canada. There's provincial organizations, and you'll find some in your local areas. So just don't give up. Just keep going, going, going. And the resources, and we're really working hard at trying to get the information out to other people of knowing what is available. And when you understand, have some education on the brain, and you understand how the brain works, which most of us don't even, we stop thinking about the brain because it's just too much a part of us.
Right.
We just stop thinking. So when we can understand what the brain does, then we start to heal much, much faster.
If you have a question for Colleen, if you're wondering if some of your symptoms are into this brain injury category, or you strongly believe and you know you have it, but the healthcare system has basically said it's nothing but soft tissue, it will go away, give Colleen a call here and express to her some of the thoughts and questions you may have. In the Vancouver area, it's 604-280-0650. Long distance toll free, it's 1-877 888-280-0650, or a reminder that you can email us during the program, and we'll even take your emails later as well, radio@bcchiro.com. So, Colleen, take us through a little bit of a pathway here. Person's been hurt in the car crash. They get an assessment or not. They're told there's nothing wrong. You'll just have some sore muscles for 2 or 3 weeks and you'll be fine. What would be some of the clues that the person should be aware of? And I'm assuming that they can be aware of them, because sometimes people's ability to reflect on what they're feeling, they don't necessarily see it as abnormal because it's just part of their daily pattern. But what might be 1 or 2 little clues that people should be taking seriously? These are folks that are not under any care.
Your sleep patterns, number one.
What happens?
We never go into the 4th REM of sleep, so you're waking up and you're tired all of the time. It doesn't matter how many hours you've slept, what you've done, you get really, really tired. If you get exhausted from simple things when you have a brain injury, from simply tying up your shoes, sometimes there's a lot of thought that goes into the lace and the intricacies of the turning. So it becomes very, very difficult. Our brain goes in overload, we get tired, we get headachy. Take your nap. Take your nap. It might take you 15 minutes, it might take you 2 hours, whatever it is. It's your brain telling you, listen, I'm tired, I can't go on anymore. And make certain that you have a lot of fluid, because our brain...
You mean drinking fluid?
Drinking lots of water, yes. And for every caffeinated drink we have, that means that we really need about 3 cups of water.
Right.
1 to 3 to match on that.
Why? Does the caffeine dehydrate me?
Yes, the caffeine does dehydrate, and the sugar drinks that you get a lot with the pops and the Gatorades, and not to mention any names in particular, but those types of drinks, they have the sugar content in them is really high, and it starts to affect your blood flow, so you have high blood sugars and low blood sugars. So it's just harder work for your brain to be pushing that blood going through your brain. And we've got 100,000 miles of blood vessels in our brains. So they're already shattered. So why make something worse? And so, those would be the first things I'd recommend. Number 1 is get your alignment checked out.
Now, just for the listener's benefit, alignment literally means your ability to move, how you sit, stand, and sleep. In other words, checking out if the 24 vertebrae in your spine have a normal mechanical function. Sometimes they think of alignment as, these curves, which may be present, but if you start to regain movement in all 24 vertebrae, the natural alignment kind of comes back.
Oh, it most definitely does. And you feel like so much better as it comes. So when your spine is aligned, your mind is aligned. So it doesn't matter that spine, and you're the chiropractor, but living on it from the other side and not knowing really anything about your body before this had happened, it's all the little nerve endings and the passageways that send the messages out throughout the whole entire body, which are so critical. And it's also why a brain injury is so difficult to diagnose, is because it isn't just a bone sticking out of your body. It's many, many different things. So the pain can just trickle through your body.
So you found, your advice to people is that there's a fatigue factor. They don't sleep well. They get tired from doing simple tasks like tying a shoe.
And they can also become very, very emotional. They can be outbursts, which sometimes if it happens to an adolescent, they will be accused of, oh, it's puberty, or he's in adolescence. And then as you go older, oh, well, she has PMS. There's always
another excuse,
another way down it. But deep inside, as you go into that room and you say, gee, I just can't remember why I'm here. And you say that to someone and they go, oh, well, that happens to me too. Don't worry about it. I really can't remember. And I remember one time, if I can just slide to the side here, I was at a lawyer once, and he looked at me squarely and he said, I know you understand, Colleen. And this was to do with a court case. He says, I know you understand. And I'm sitting there, yes, but I forgot what I understood. So
your short-term memory, or just your whole comprehension?
Yeah, just the whole comprehension. It just wasn't there. And you just go through different stages, and you go through plateaus, and then you make another step up and another step up. So it's not an easy recovery, but getting the alignment, getting the right foods in your body, getting the right sleep, those are stepping stones, and everybody can do them.
Now, you found that this is now 5 years has gone by, and I think one of the important things to stress with most spine and spine-related injuries that are of this kind is that you do get better. It's a challenging long road to be sure, but we should probably not be dismissing people's symptoms as it's not there, it's just soft tissue, don't worry about it, because that's a denial. And that really frustrates the patient who experiences with their feelings daily or on a regular basis.
Well, that's right. And the more stress you're being put under by telling everything's all in your head. Well, yeah, it is in my head.
That's where the brain just happens to be.
Literally.
So it makes it very, very complicated.
Now, along with your book, Concussion Recovery, written by Colleen Butler, www.brainnavigators.com, you've actually stepped forward and dealt with your brain symptoms and your brain recovery in a manner that you're trying to reach out and help other people. How are you doing that?
Well, we're starting to do with workshops, and I'm doing library readings. We're working at the Tommy Douglas in Burnaby on the 23rd of this month. So we're coming out there. We're trying to go to sports organizations and letting them know that education is power. And when you've got the education, then the after effects and the aftermath of the dementia and the Alzheimer's and the schizophrenia, the Parkinson's, all these other diseases we have, they can be nipped right in the bud. And that's the most important part, is when we can get them diagnosed and start working positively, then we can go there. So I'm trying to do putting forward workshops. I've got a workshop coming up in Nanaimo. And that's
so October 23rd is a Tuesday, and you're in Burnaby.
Yes.
And the one in Nanaimo is when?
It is November 15th to 18th.
Okay. Now, all of these dates and contacts, we will be putting these on our website. So if listeners, don't worry. And if you come back later and you say, gee, I heard this, I got to pass it on, you can come back to Podcast Dr. Don. You'll see the program of October 15th. We'll have it labeled brain injury. And the contacts for Colleen, the book, the Burnaby session, the Nanaimo session are going to be there. And give us just a sample of what you do with the people at those sessions.
Well, the first thing we'll do is we will eliminate whatever their stressors are. We keep the group small enough that it's really an individualized part. And then when we can get them de-stressed, then they're able to start learning again and start focusing. So we will do meditation. I have a CD out, or a DVD that'll be out by the end of the month, and it's workouts for the brain. So we'll go through there of learning how to turn the brain on, connecting the brain, and making us go forward, working on the spine. So we'll do a lot of physical exercises for that person, for whatever they can do. So there's nothing set as in you must do this to come here. We make everything work for the individual.
Did you, when we started the program, we talked to Dr. Freeman there, and we briefly reviewed that recent MRI finding. Was that new information for you too?
Oh, 100%, yes.
So I suspect and we're going to do our best to make sure that that's, broadly circulated to clinicians of all kinds in British Columbia, because it strikes me, at least, I'm still in practice part-time as well, and it strikes me as some huge information that perhaps you would have benefited from had we known in 2007 to, number one, do an MRI, number two, do it upright, not laying down.
Yes, it's all of those simple things. And in the medical field, they are so overworked for the doctors for maybe things that aren't that important, of a cold or something, and maybe if they had more time to be able to spend here to go forward, it would really help. But the education is number one, and you just can't keep up. You can't keep those long hours going and keep up with all the information. And that's why I really believe that you are your best doctor.
You are your best doctor, and that's something that we've heard from the Ministry of Health in the past. The greatest untapped resource in healthcare is the consumer. Well-informed patients get better care from their doctors and provide, importantly, better care for themselves, and that's what Colleen has been telling you. The issue at hand is how to get the right information into the hands of the right person at the right time, and more often than not, that listener is you. You, the listener, you, the patient. Colleen, thank you so much for coming on the program tonight. We're going to follow what you're doing with these self-help programs that you're doing for brain injury people, because I know in my practice there's someone waiting for information on resources, and I'm going to pass this along to that patient. So I want to thank you very much for taking time to come over. We saw you at the American Congress for Rehabilitation Medicine this past week, and you stayed over for Monday night to do the program, and you're headed back to Nanaimo?
Yes, I am.
Well, all the best to you in your travels. We'll be in touch with you again, and we'll do what we can to bring awareness of recovery from brain injury, concussion, and like. Thank you so much.
Thank you.
You're listening to the Dr. Don Show live on AM 650. It's always your health, and it's always your life.
The Dr. Don Show. It's your health, it's your life. On the Astral Radio Network. There's still lots more ahead.